welcome back. This is Dale with Medigap Supplement Headquarters. Today's topic is the difference between Medicare and Medicaid. Now, Medicare is a program that is designed mostly for people turning 65. There may be opportunities for some folks that are a little bit younger to receive Medicare, and that's due to a disability. You know, original Medicare is discussed in other videos. Medicare is comprised of Part A, which is hospital coverage, Part B, which is doctor coverage, and Part D is prescription drug coverage. Those are the different parts. Part C is the Medicare Advantage side. Then, of course, you can get a supplement to cover the original parts of Medicare. A deductible, B deductible, or actually A deductible, 20%, and excess charges. That would be the most popular, one of the most popular MedSup plans. Now, Medicaid is completely different. Medicaid does not have an age requirement, doesn't have a disability requirement. It falls into the category of folks that have low income themselves, as a family and household size, have low income, and there's income levels and resource thresholds to for a Medicaid situation. When you are Medicare eligible, you receive Medicare, and then you get Medicaid through it's a program that is coordinated between the federal government and the state that you live in, and you can become what's called a dual eligible plan that works with both your Medicare and your Medicaid. So one of the things that Medicaid would handle is, or if you've heard of the Medicare Savings Plan through the Department of Children and Family Services here in the state of Florida, that plan has different levels to it. But one of the levels is QI1, which is Qualified Beneficiary, and that first level pays your Part B premium, and then the other levels would be SLMB, SLMB plus, and Q qualified full Medicaid. So QMB plus, QMB and QMB plus, and so there's a chart that shows the various levels of income and resources to qualify. The administration of it is done through the Department of Children and Family Services. There is a website that you can go on through what's called setting up an access account. And myself or one of my team members can help you through this process, but you can actually apply online and to see what type of coverage you might be able to qualify for if you fall into these income and resource brackets. So there is no age barrier on Medicaid. There isn't an age barrier on Medicare. If you're disabled, you can get Medicare after 2 years of being disabled, or there's a medical condition that qualifies you for Medicaid or Medicare right away. So those are the brief synopsis of the differences. So Medicare is when you're turning 65 for the most part, unless you have obtained a disability and that you qualify due to a disability, and you've had that disability for usually a period of 2 years, then you qualify for Medicare. And then Medicaid is for low-income individuals and families, and it's all based on income and resources to qualify for Medicaid. So it's completely two very different types of insurance that are available. Medicare is the federal government, where Medicaid is both federal and state funded. So if you have any further questions, if you're seeing this on YouTube, you can go to my website, MedicarePlans4US.com.
Thank you for watching this video. There's more to learn from our library of resources on the website MedicarePlans4US.com. The link is in the description box below. If you would like to learn how you can get your questions answered by our Medicare specialist at no cost to you, click the link in the description box to get started today. Visit the description box for more tips on cutting your out-of-pocket Medicare costs from the Medigap Supplement Headquarters.